WOCA. Ocala.
All right, 5 minutes after 11 o'clock. Thank you for tuning in. We don't live that far from one of the tourist capitals of the world. And if you go into those theme parks, some of the rides have certain warnings. If you have a heart condition, don't get on this ride. If you have epilepsy, don't get on this ride. I'm sure you've seen that, right?
Oh, yes.
And I always feel bad if there's a child with epilepsy and there's a ride that he couldn't or she couldn't wait to go on, and now you see that sign. It's like, oh, man, this is the one I wanted to see.
Yeah.
But epilepsy sometimes it can be triggered by, I guess, the lights and the sound. I don't know a whole lot about it, but I remember seeing a family that the whole family didn't go on the ride because the child had could have had a seizure. Yeah, I guess that's what that is. So let's find out about this a little bit. Dr. Elaine Wyllie is on the phone. She's board certified by the American Board of Pediatrics, Sleep Medicine, and Psychiatry and Neurology with special I can't even say the word.
Competencies.
Robert. Thank you. Competencies. In pediatric neurology and epilepsy. She's at the Cleveland Clinic. She's going to talk to us about epilepsy. This is National Epilepsy Week.
Yes.
Coming up. Good morning, Doctor. We're in it right now. Yeah. Good morning, Doctor.
Good morning, Larry and Robin. We appreciate this opportunity to raise awareness of epilepsy here and at home throughout the country today, prompted by National Epilepsy Awareness Week in Great Britain. In the U.S., we actually dedicate an entire month to epilepsy awareness, coming up again in November.
Oh, is that right?
Thank you for having us.
Well, the question I have, based on, I don't know, hopefully you heard the opening about the theme park warnings. You know what I'm talking about?
Yes.
Okay. Now, when somebody goes on a ship, they say you can take Dramamine for that. Is there something that somebody with epilepsy can take so that they can go on a ride like that?
So the issue about the rides, usually where this comes into play is on roller coasters and other types of rides where, imagine this, if a person's on one of these rides and they suddenly lose consciousness, are they going to be safe?
Oh, my goodness, yeah.
Yes. So obviously, most people with epilepsy can ride roller coasters from a medical standpoint, but there are certainly some issues to consider with theme parks as well as other activities in life, such as scuba diving, skydiving. You know, the usual rule of thumb is you think if a seizure occurred during that moment, would it be safe or not?
Right.
And as you know, epilepsy is the term we use when a person has seizures or is prone to seizures, which are unusual behaviors and movements caused by temporary disturbances in the brain's natural electrical activity. And the outward signs of these seizures may vary from person to person, but they often involve some loss of control of awareness or body function, and that, of course, could be a threat if you're engaged in something like being on a roller coaster.
Sure, yeah. Well, that makes sense now. So, but the flashing lights, because I've seen the warning on video games as well.
You raised a very good point, Larry. It's true that some persons with epilepsy, not all, and as a matter of fact, a minority, but some persons with epilepsy are sensitive to flashing lights. We call that photosensitivity, and it usually takes quite a strong stimulus to actually provoke a seizure. But there are some people who find themselves sensitive to things, for example, strobe lights and discos, or highly activating, visually aggressive video games.
And when a person is diagnosed with epilepsy, can a person have that be controlled, or do you have to do surgery?
That's an excellent question, Robin. And fortunately, we have many advanced anti-seizure drugs today that are safe and effective. allowing us to control the symptoms for most people. You probably know that epilepsy affects over 2 million Americans, including people of all ages from every walk of life. And most of your listeners probably know someone who has epilepsy. They may not even be aware that this person has epilepsy because in the majority of cases we're able to control the symptoms so that there are not significant outward signs and people can live normal lives. But that doesn't always happen, and unfortunately there are some situations where we can't control the seizures completely with medication. And in those cases, perhaps the top point for our listeners today, for your listeners, are that specialized surgery may be the answer. We want to be sure that families who are affected by this condition are aware of that option.
Is it easy for you to explain to the layperson what exactly happens during that surgery?
Certainly. A lot of planning goes into the surgery. That's the most important part. The first step is to determine with detailed testing whether or not there is a troublesome spot in the brain which is causing the problem. When the answer is yes, then the goal of the surgery is to remove the troublesome spot to stop the seizures from occurring. And to arrive at that decision, we look at results from recording of the brain's electrical patterns on an EEG or electroencephalogram, and we compare them with the results from other testing, including a picture of the brain's anatomy obtained with MRI. And when the results match up to highlight the same brain area, then we may proceed to remove the troublesome spot with confidence, while of course preserving any nearby brain regions that are important to brain function.
Oh my God!
That sounds something new. I don't remember ever hearing about that in the past. Was I just not on top of this subject? Of course I wouldn't be, but I had never heard of surgery to correct things that are causing epilepsy.
You're absolutely right, Larry, and that's why we're so grateful for this opportunity to speak with your listeners. Sometimes people are simply not aware that there is more that can be done in some cases. And we really, of course, all want the same thing. We want to offer people a better life, and sometimes that is achievable through surgery when it can't be obtained through medication.
Can I ask this? If a person is familiar with their own selves and they know that they have seizures now and then from epilepsy, and they go through the surgery and they don't have any seizures, are they still gun shy? Do they still feel like it still could happen because they're kind of not embracing the fact that they might be cured?
Larry, that's such an astute insight. One of the most frustrating and upsetting elements of epilepsy is the unpredictability of when a seizure can occur. So persons with epilepsy live with that uncertainty, and it is one of the greatest burdens. After surgery, if everything goes the way we hope, then there are no further seizures. And initially in the first year or so, we, of course, watch very closely. Most of the recurrences, if it happens, if a seizure is going to come back, it usually happens in the first 6 months. So the longer we go after the surgery without a seizure, the more excited and hopeful we become.
Wow.
And eventually we continue the medications just in case, because as you point out, we have to wait and see a little bit. But if we get the result we're looking for with no seizures for 6 months and then a year, and if everything looks really good, sometimes we can even move away from using medications altogether and think of epilepsy as something in the past. With that said, however, we always maintain the same recommendations about seizure precautions, which are simple things like take showers instead of baths, because a bathtub is like a little swimming pool, and you try to imagine what could happen if you had a seizure and you were in the water and you were not supervised. So some basic issues of prevention are always relevant, but there is nothing more rewarding than seeing a person with seizures to be freed of them.
Oh, my gosh.
Those have been some of the most rewarding experiences of my career. I've been guiding patients of all ages through surgery.
I'm sure it's life-changing for those people, especially if they're the young ones. Well, everybody, every age group, I'm guessing. Well, this is good news.
Absolutely, and you brought something up in your first conversation about how it's not even just affecting the person, it affects the entire family.
Yeah.
You talked about how the whole family couldn't go on those rides because of the child. And Certainly, in daily life, that becomes an issue. Some persons, when the epilepsy is poorly controlled, need a great deal of support and supervision, and it can really change the lives of everybody involved.
Yeah. Well, good information, Doctor, and it's easy to understand why a short interview is not going to answer all of the questions. We don't expect it to, but we'd like it to give us a little bit of information and then a way to get more. And I'm guessing there's either a book or a website. Am I right?
Certainly. There's always a website, right?
Yeah.
For anyone who's experiencing uncontrolled seizures, we strongly recommend scheduling an appointment at a specialized epilepsy center. And for more information, we'd welcome visits to our website at clevelandclinic.org/epilepsy. Our specialists would be delighted to work with your listeners and their families. We're so grateful that you gave us this chance to reach out.
Oh, and the gratitude is ours. The honor is ours, Doctor. I know we have listeners who will benefit from this. For those who want to share this, we do record them and put them up as podcasts, and they're usually up by 2:00 in the afternoon of the interview. Thank you, Robin. Thank you, Dr. Elaine Wyllie. Thank you for what you do, and thank you for taking time out of your day to talk to us about it.
Thank you, Larry and Robin. It was truly a privilege.
We'll be right back.
The weather is brought to you by myfwc.com. Safe boating is no accident. Mostly sunny for this Tuesday. Breezy in the afternoon, high 84 at the coast, 92 inland. Clear Tuesday night, low 67 inland, 76 along the coast. For Wednesday, partly sunny and becoming breezy, high 85 on the coast, 92 inland. Thursday, partly sunny, breezy in the afternoon, high 83 on the coast, 91 inland. From the Florida Weather Center, I'm meteorologist Joe Lundberg.